Guys, Dr. Capone, Mahoning Valley Wellness. Today's topic is going to be seasonal allergies. The weather is changing, the temps are dropping, people are sleeping with their windows open more, and unfortunately this is the start of seasonal allergy season. So we're starting to get itchy, watery eyes, gritty eyes, itchy ears, scratchy throats, runny noses, sneezing. Those are all your seasonal allergies. They come from pollen, from trees and grasses and weeds, or mold spores in the air that typically happen after a heavy rain or when the weather gets really humid. And they affect you with the symptoms that I mentioned before, with the sneezing, the runny, itchy, watery eyes, the itchy ears, the scratchy throat. There are things that we can do to treat these allergens. The first thing is nose rinses. Rinsing out your nose with salt water can cleanse out the pollen. And there are already prepared preparations you can buy. Just follow the directions. There are steroid nose sprays out there, like Flonase. They're over the counter. You don't need a prescription for them. They work well. They actually work better than the next category of antihistamines I'm going to talk about, but you have to use them every day, and they may take a few days before they even take effect. Antihistamines like Claritin, cetirizine, Zyrtec, Allegra, those are over the counter. They work great too. They will help stop the itching and the sneezing and the runny nose symptoms, but they don't help with the stuffiness. The stuffiness, you'll need to use a decongestant like a Sudafed. If you have high blood pressure, you need to ask your doctor if that's okay, because it's typically not recommended to use a decongestant with high blood pressure. And also, you don't want to use it for too long of a period of time because it can have a reverse effect. There are antihistamine drops out there for that gritty, itchy feeling in your eyes. You can use those. They work well. And then if all that fails, you can go to your doctor, get a referral to an allergen, and they can talk about doing allergy shots where they shoot you up with a micro amount of each allergen that you're allergic to. And over time, weeks to months, that can decrease your symptoms to that allergen. How do you prevent these symptoms? Well, the first thing is that if you notice that every year around the same time of the year that you get these symptoms, you might want to start taking your antihistamines and your nasal steroid a couple weeks before that time period, and that will help prevent your body reacting to those things. You can stay inside during the times of the year where you have the symptoms. You can keep your car and house windows clean and closed, and just use your air conditioning instead, which hopefully filters out the allergens. Take a shower before bed and rinse the pollen off your body and your hair especially. Wear a dust mask if you have to be outside and your allergens are really severe. Washing your bedding every week in hot water with detergent and dry it in a dryer in hot settings can help too as well. Make sure that your comforter and your blanket also are washed. Cover your pillows and your mattresses with vinyl covers to protect also from dust mites and spores. And then clean your air conditioner furnace filters more regularly. And you can even use the special allergen filters, and that will help filter out some of that pollen and mold spores that you get. And then vacuuming at least every week using a vacuum that has like a high efficiency particulate air filter or a HEPA filter really helps get out those pollen and mold spores that are in your house. Okay, that's Dr. Capone, Mahoning Valley Wellness. Stay healthy, everybody.